One of the most dangerous and potentially disastrous things is misinformation, false information, especially when it comes to things such as education. We have a constituency of students and learners that are represented in 14 regions. In all of the 14 regions, all of the schools from grade 1 up until grade 12, and then all of the tertiary institutions. So it makes it very difficult for us, Sharonese, with the capacity that we have to be able to reach all of our constituents with concise information, particularly because the number of institutions that we host as an organization are so many. Ordinarily, it would be possible, but in a crisis such as this, that came so abruptly, it was a bit more difficult. And the MICT, we must commend as an organization for the tremendous leadership that they've shown during this time. We've seen lots of misinformation that was spread around, but we also recognize that the Deputy Minister made an active effort to clarify in times where false information was spread. And really all of this would not have been possible only with the organization. It is the aid of the MICT and other stakeholders that made this possible. But what was particularly striking about the leadership at the MICT was that they did a thorough stake analysis. So in the way in which they identified stakeholders, you could see that it was very strategic to ensure that from the most pertinent issues down, all interviews were held. But what we as NANSO appreciated most was the fact that on the very first day during when the MICT launched the coronavirus update program, education was identified. So it tells you that we have a leadership that recognizes that the education sector is one of the most affected areas during this time. And we really warmly welcome that. We were also asked to be on the panel on that time, and it just shows that the MICT really were very strategic when they did the identification of stakeholders to be part of this program. But all in all, we commend and we really appreciate that they made the work of the organization so much more easier, particularly during this time.
One of the first things that we greatly have to acknowledge in the first place is that Namibia is one of the few countries that actually developed a communication center to inform the public about the effects, the impacts, and about the regulations that are set to address the pandemic. Well, and from the agricultural view and the point of sector, it's more of a practical to say it have to do with policy settings and in complementing now the communication center, such as the fact that most of the rural, most of our local producers are located in communal areas, and such in communal areas we have challenges of accessing to the TVs, to the radios, or to sometimes to the social medias, and the most of the robust strategic that the MICT used was to coordinate together with local radios, in a diversification manner, to the effect that they usually use to update people in communal areas about the effects and about the regulations or any update that have to do with the pandemic. And for this, it really helped us to reorganize our local producers in terms of resale, because most of them were actually affected that they have fresh producers that were not able to resell, and through this communication it was actually enabled us as the youth in agriculture leader to reorganize them, to bring them together and have a diversified strategy to the local market of being able to sell to AMTA that actually sold to the retailers.
The center has been crucial in ensuring that the Namibian people are hearing and receiving accurate and timely information. The stakeholders that were here were strategic, as said by patients. They were providing leadership, providing information from all those sectors that was accurate, that was needed and necessary at the time. For us at AFRIAN, I think our mandate is sexual reproductive health rights and ensuring young people have access to comprehensive sexuality education, they have access to materials that protect them during sexual intercourse, etc. One thing which was very difficult was that young people didn't want to go to health facilities, especially the mobile clinics in the rural areas. Because of the pandemic, young people feared that going there to receive other services was going to be them putting themselves at risk. So the center demystified some of the misinformation that was happening. The fear that was there was taken away by the information that was provided by the health ministry and by the different stakeholders. And I think it helped us better, especially with the NAPA clinics in the different regions and the mobile clinics. The stakeholders were able to reach our constituents, and we were better able to inform our position. Whatever we were telling them was substantiated by what was being said and being provided by the center. So for us, the center really helped us to ensure that our constituents were able to receive the resources and the services that they needed in terms of SRHR.